Hey everyone! As promised, this is OT Life Hacker with OT 101 on delegation of tasks for the COTA. It is the responsibility of the OT to determine how to delegate responsibilities for the COTA. There's so many variables to everything. The books may say this, but then your company may say otherwise. You may have a rehab director who delegates the tasks already between all of you, and so you don't really have a say in how things work, how much contact you have with your COTA, or the level of supervision that you're going to give. Keep that in mind. But if you do have the privilege to create that delegation, what factors do you consider when you're delegating tasks to the COTA? Write what you've experienced, you've learned, you've seen in the comments below. Thanks, guys. Now, knowledge, skill, competence of the COTA. How is this demonstrated? Like I mentioned in my other video, and for more details on that, please do watch the other video. How you figure that out can be through checklists, can be through asking the COTA and observing them. So you both can work out how the delegation is going to work. And then we have the needs and requirements of the practice setting. So essentially the needs and requirements of the practice setting and the complexity of the interventions, it all goes back to the skill level again of the COTA. Have they been doing this for a long time? Say, for example, you're looking at falls. See a client who is at risk of falls, you need to provide assessments like balance, gait assessments, and interventions, treatment plan, that has to be provided. You are the OT who created all of these goals and plans. And then you have a COTA who is newly put into this home health setting, say that's where it is, a home health setting, but they've worked in skilled nursing facilities for a long time. Very likely, and again, it's most important to ask them, do not assume, ask them, but very likely they will have experience working with the falls assessments and interventions related surrounding falls because, and working with older adults and their caregivers and even anyone else who's involved with the older adults and knowing resources for older adults, very likely this COTA will have that knowledge. Then we have the safety. So safety for the client and yourself. Know the limits. So when you're delegating tasks, again, this goes back to competencies. It is so critical. Competencies in the COTA and again, the OT, you need to know, will the COTA be safe with the client for themselves and for the client? Do they feel that they're competent in carrying out this assessment? Or do they feel that they can do it, this intervention, this treatment plan? What's the solution? Ask them, always ask, always collaborate with each other. That is so important in the field of occupational therapy. Keep that open communication. There is always so much more to talk about on this, and I am only a student, so I am looking forward to hearing what you experienced, OTs and COTAs. Subscribe, like, and comment. All right.